Media has called you miracle worker. It has also tagged you as baby factory operator at this place.
You may love them, you may hate them, but you cannot ignore them.
When she gave birth, it was not children. It was a pound of flesh.
Actually, this is a part of cloning that they say.
The first case in Asia with which you have dealt, and probably the fifth case in world of a mother being a surrogate for her own daughter.
So she went into a hiding for last 4 months, telling everyone that I'm going on a pilgrimage. The grandparents I've seen touching my feet. And because of you, my son has a child now. So these all are, I tell you, God-gifted moments. The tagline that Oprah Winfrey gave to surrogacy was like unimaginable. She said, one woman helping another woman, I love it.
Welcome to another episode of Baroda Unfiltered. Our today's guest needs no introduction. She is renowned globally for her expertise, for her achievements in assistive reproductive technologies. She has been the light of lakhs of such parents who have been able to conceive because of her help. She is so much popular that she has been called upon by the world's most popular show, Oprah Winfrey. Apart from that, she has also been aired on BBC's Hard Talk. She has also shared space on the cover page of a famous magazine with the then India's Prime Minister. She is none other than Dr. Nayana Patel, who is famous gynecologist, famous IVF technologies, and also the Director of Akanksha Medical Hospital. Welcome, ma'am. First of all, I would like to express my deepest regards, sincerest gratitude that you have accepted our invitation and you are here on Baroda Unfiltered for our Barodians, for our Gujarati people, for our Indians. First of all, would like to narrate an instance here. While I was entering this Akanksha Hospital, I realized that how huge this hospital is. I entered inside. I walked past by a baby who was carried by a nurse into that tub, and just his father came and he leaned upon. He tempted to cry, but somehow he stopped his tears. He was tempted to touch him, but nurse stopped him. And soon after, I saw another baby was carried into the lift. Then I realized that this place is not as huge as it looks from outside. It should be more larger, more huge than what exactly it is, because happiness here has filled all the places inside this hospital. How do you feel by being inside this hospital, by being amongst all these people who is bringing joy to you on daily basis?
I mean, I can tell you that after this 4 decades of experience, I can tell you that how wonderful it is that you have delivered a baby. Now you are delivering their baby. You have done IVF for the couple. Now you may be doing IVF for their children and the grandchild. So I have seen 3 generations and I have delivered. So that joy, especially when they grow up, they come to you, they send their picture. The patients, like, they tell the baby that this is your hospital, and the baby says, I've come to my hospital. That joy is, you cannot describe it in words. It's the satisfaction, the mental peace, and the moment to thank God that, yes, you have given me everything that a person would want on this earth.
I can see it in your eyes.
Yes.
And actually, while narrating this instance, I am feeling that goosebumps.
Yes.
That happiness is another
Cannot
of another
describe.
universe. Yes.
Neither
it
the
is.
couple can describe, nor I think I will be able to describe that how happy we are. I mean, just tears roll down your eyes when you see a couple who has strived for 2 decades and then finally hold a baby in their eye, and then they come after 5 years to show that baby, saying that, look, this is the temple, this is the God where you were born. And you cannot even register that much of happiness you get. That, okay, at least you could do this much in life, and God made me instrumental in doing this.
This is really great. And talking of baby, as today we are doing this podcast for the occasion of World IVF Baby Day. So very fortunate that we are doing it here in Akanksha Hospital. The thing which I would like to ask you here is, in 1978, Louis Brown, the first IVF baby, was born. And then, while I guess you were studying at that time,
Yes.
medicine, yes, and somehow it interested you, it hooked you as a doctor, and then you uh, came to Anand, you practiced here, and in 2000, when at one point of time you were seeing the miracle happening somewhere else, and now you did the same miracle in 2000 in Anand. So what was the journey? How was the leap? You have seen it happening at somewhere, and now you are doing it at your own place in your own town.
So when you see this, you feel that this is impossible. This can happen only in London and in UK, US, not here. Because Anand was that time a small town, I would say barely bigger than a village with 150,000 people. You did not have those regular phones also.
Yes.
We had to call up to get the number through
2000s.
the, yes. So operator ke saath phone we used to do it. So now when I saw this and I thought that yes, I should try this in Anand. There were people, there were doctors who used to laugh that how can this be possible in Anand? Because you never used to get the raw material which we needed, the skill that we needed, and how to explain the patients. But somehow, when you decide that you want to do something, especially treat infertility, get the patients, the females pregnant, and do an IVF, it is your willpower, it is your passion. I would say the right word is passion, that I will go to any extent to get all of this and see to it that IVF and an IVF baby can be created in Anand. And that is what made me go ahead.
This is great, ma'am. This is great. And probably this is your passion, who have kept you pushing, and you have been able to do that. And related to that, because that time in 2000, the society was very conservative, and what you were thinking was out of bounds for them. So probably this passion has kept you pushing forward. Or us time pe, jab society was very much conservative, you came here, you did this, and you have faced labels by media too. Media has called you miracle worker. It has also tagged you as baby factory operator at this place. So at the same time, you were dealing with the miracles and you were dealing with such jargons. How did you uh, deal with it?
So that is surrogacy. And I say surrogacy is very close to my heart. Anyone can think whatever it is. Because I saw those helpless women who had everything but did not have a uterus to carry a child. God had forgotten to put that in their body. And there were so many other women who wanted to help these women. And that is what I felt, that we are going to bring beautiful babies onto this earth. This lady is suffering from infertility. She is going through a very bad time in her life. And then there are these girls who want to help this lady. Why not unite them? And I started surrogacy. And I got all sorts of names. There were people who praised me. There were people who criticized me. And the best example was the week where we were 25 people on it. You may love them, you may hate them, but you cannot ignore them. And I don't mind that. Any tag you give me, I don't mind. Because at the end of the day, you are trying to help people in the most ethical way, I would say. There is nothing illegal, there is nothing unethical about it. Because ultimately, what? They both want happiness, both the couples. Yes, that time the surrogates were compensated so that couple would see that the surrogate has a good life after this, the beautiful baby on this earth. And I still don't see anything wrong about it. Surrogacy is the way of life for a certain group of people in this society, and it will continue. And it is not from today. It is from old times. Even our Mahabharata has mentioned surrogacy. So don't look down upon it, but look upon it with dignity and respect.
As you mentioned Mahabharata episode, we will take it up later when we will dig much deeper related to IVF so that our audience can relate to it. But before that, would like to highlight here that you were simultaneously doing two jobs. In regular job hours, you were doing regular gynec work, and in the odd hours, you were pursuing your IVF passion. So how you were managing two things at the same time, and at what point you realized that this ought to be my mainstream work now.
So when I started IVF, it was early mornings only because 9 o'clock my bread butter would start. That's a routine obstetric and gynec OPDs. But if I have to do something new, I have to give extra hours. So I had my embryologist coming from Ahmedabad. He was a simple guy coming on a Lambretta, parking at Kalupur station, taking a train, coming here. 5 o'clock, I'll reach the clinic. The IVF patient is ready for egg retrieval. Then both of us will sit in the lab. He will wash the eggs and praying to God that this time it should fertilize and we should get a result. There were months of trials, yes, of course, and there were about, I think, 8, 10 failures before I got my first result. But each failure, rather than putting me back that, okay, this will not work, we give up, we tried to improve. And ultimately, there was a doctor over here and quite an old person. He just came holding the hand of one young girl, saying that she's from my village, her tubes are blocked, get her pregnant with IVF. And he just left. Ishwarbhai Patel, I still remember. I said, how much of trust he has in me that he is bringing this girl over here like this. We worked hard on that couple. The tubes were blocked. We put the embryo and she was pregnant and she delivered a healthy baby from Palej. That boosted my confidence that yes, if you go with a positive mind, definitely you can achieve whatever you are targeting. And I still believe in that. And I want my Gen Z to believe in that, the next generation.
This is great to hear, ma'am, that somebody is coming and handing over their baby to you just to have another baby.
Yes.
So this faith, this belief, it all comes with blessings, I would say.
100%. It comes from blessings. I tell you that all the miracles that have happened, God wanted them to happen. And that's why they've happened.
This was a great learning for our viewers too. Another thing I would like to ask you, you have grown up in a relatively smaller town. आप शायद राजकोट में you have took birth. Then you went on to establish your practice in another relatively smaller town then,
Rajkot
Anand.
also, yes.
Yes. So you have started your practice here. But at that time, ample opportunities were there. You could have gone to big city, as you were telling, you were waiting for things to come down to Anand and then you used to carry them from railway station. All these hassles would not have occurred if you had have done this practice somewhere else in a larger city. आप शायद मुंबई में करते, all these places, all these things would have been in place. So what made you to choose this place and to decide that you will do your practice from here only?
I tell you, no place is big or small. It is you who make that place big or small. When I was in Anand, it was smaller than Rajkot, yes. But if I look at it, I don't have no words to thank people of Anand. It's a small town, but relatively lot of Western exposure because it is full of NRIs. Anand, surrounding areas. So they have seen the Western world. Rajkot was a conservative society, but central Gujarat is not that conservative. When I came up with surrogacy idea, I think that Anand people accepted it very positively. And that was because they had heard of this abroad somewhere, or they thought that there is nothing illegal or unethical about it. So I'm thankful that I was in Anand. Yes, people ask me, if you had been in a bigger city, you would have more opportunities. You would have grown much bigger than what you are. There would have been 10 Akankshas. I said, no, Akanksha has to be only one, and that to be in Anand. Those people who want to have the facilities which Akanksha provides should come to Anand and get it from here, because I want to give it back to my Anand, what I have got from my Anand.
Probably this was what the intention, and probably their Akanksha too. Local people would have asked for this and they have got this blessing. Thank you very much, ma'am. For someone who is coming to you as a patient, probably they would not have sat into their biology classes at all, or probably they are not biology students at all. So what do you tell them that this shall happen since the day they have decided their IVF cycle and the day the embryo goes in?
Okay, so first of all, now the awareness is there because there are some of the movies which have shown IVF, etc. But patients still are patients. They are totally unaware about what's going to happen, how many eggs, what will you get. So we have to tell them the total explanation that why IVF is not something very unnatural. Only thing is that fertilization of the egg and the sperm, which happens in the fallopian tube, we will do that in the lab. This reason could be the blocked tubes of the husband's sperm counts are very low, and naturally you produce one egg. But for IVF, it would be good if we get 8, 10 good quality eggs, so that in one cycle also we get good number of embryos, and then you don't have to go for another retrieval. So we start those injections, take out the eggs, and at each stage we counsel them. We also show the pictures of their embryos, how they look. On the ultrasound, we show how many eggs. So the patient can relate, okay, this is happening in my body, and this is what they are going to do. So the counseling, the first counseling is very, very important. It's a realistic counseling, a scientific counseling, and a financial counseling. So realistically, they know what their chances are for success. So the counseling part is very important. And especially with surrogacy, it was a very difficult task to explain them that what is surrogacy. A surrogate mother will not know how she is getting pregnant. So we have to explain that this is the embryo, we put it back in your uterus, and then you deliver a baby. There was a father-in-law of one surrogate mother that how can you get pregnant like this? So he came every time she came to the clinic, and when we were doing the embryo transfer, he saw to it that there is no gentleman entering the lab. He sat outside, and fortunately myself, my embryologist, all are females. So he saw that the room is empty. We all went there. The daughter-in-law came there. We transferred the embryo, and then he was satisfied that, okay, this is done like this. So this was the level of counseling we had to do to the patients and the surrogates and their family.
Now, this is one thing which people see through a specific lens, that all gynecs, all obstetricians should be female. But nowadays, this practice have larger been adopted by male gynecologists too. How do you see this transition, being yourself female gynecologist?
I mean, gynecologists, male were there always, but females are still preferred. I would say in my OPD, I still get 15, 1, 5, 15, 10 to 15% of the patients, not the husband, the female herself insisting that I want a lady doctor to check me. And we have to respect that. So combination of male and female gynec is good, but it is, yes, previously the females were shy of male gynecs, which is not seen anymore. That's
Now, coming back to IVF thing, you have said that IVF should not be judged from case to case. It should be seen differently. So, what does one failed cycle tell you, which a successful doesn't?
This is a very important and very interesting question, because not all IVF cycles are successful. Each couple will have a different success rate, varying from 20% to 70% also. So the moment a patient gets a positive result, they hardly meet me and I have to just congratulate and they go to the junior doctor. But there is a negative result, and I sit with the patient almost for 20 to 30 minutes, analyzing what went wrong where. In fact, on the day we do embryo transfer, we know what is the success chance of this patient. It's based on a number of factors. And that is the beauty of analyzing a negative result and converting into a positive the next time onwards. So I tell the patients that even if it is negative the first time, it will give us a lot of information, the quality of the egg, embryo, your lining, what was there which could have given a negative result, and then improving on that will give you a positive result. So analyzing the negative IVF result is an art which an experienced IVF specialist will have.
But here is one thing which is a very interesting point too. If you are dealing with a patient who has many repeated failed cycles, अब आप उसके साथ जब next cycle में बैठ रहे हैं, every time it is getting very hard for you to and for him to as a patient to understand, because that kind of patience is now it has testing limits. So how do you deal with such patient with whom you cannot scientifically work anymore, and you have to tell them now this is it? but he is not accepting it. He wants to move ahead.
So there is one thing that I would say, that again the experience matters a lot in this. So the patient would always want that, no, I want to go ahead with it. And we have to say enough is enough, where now you have a very less chance or no chance at all. And think of surrogacy or donor gametes or adoption. But the counseling should be in such a way that the patient will not feel that, okay, now I'm left just like this by the doctor. No. When we start the IVF cycle, we always say, let us say that in 3, if the world over the average success rate is 35%, we should consider 3 cycles. Okay. First, if you are lucky, you get it. Not second, we improve the chance. Third. But when we know that nothing is going to work now, we have to hold her hand and explain it to her very nicely, very practically. And I think that is again a beauty of this full treatment. It's difficult on the part of the doctor and the patient, but gradually the patient will realize and accept it and go further in life with other options.
Now, coming to this IVF, now the whole world sees the root cause of the IVF is why IVF started, because of infertility problem. Now the whole world see infertility through a certain prism. वो एक taboo के साथ आता है, वो एक stigma के साथ आता है, and it is very hard to deal with such things. पहली बात तो लोग they are unable to plan it even ahead of time. For example, as we were discussing before this session, कि लोगों को plan करना चाहिए at the late 30 stage. They are unable to plan it because they are unable to think that this cannot happen to me. And all of a sudden, if this is happening to them, then they are thinking that why this is happening to me, because they are seeing through that prism of taboo, that stigma. How does the taboo, that stigma, waves off when they comes at the door of Akanksha Hospital?
Yes, very important and very interesting. First is the denial mode. This cannot happen to me. Second is the acceptance. Once they accept, then they are ready to go for the treatment. So my advice is that always test your fertility at a young age. And this education should come from school, because people see that everybody gets married, everybody gets a kid, so it's no difficult thing. We can also have a kid whenever we want. And they get married at 38, come at 41 to have a kid when hardly there are eggs there. So in the school, or at least in the college, the fertility checkup should be like any other checkup. In school, we have dental checkup, cardiac checkup, full body checkup. Why not this? At least in the college or high school, the semen examination of the male should be done, college, and the female should undergo at least an AMH level and a scan report. These 2 things, if they are done for the female and one for the male, they would know that, okay, they do not have a problem. If they have a problem, they approach to this early in life rather than later.
Yes.
And the taboo around it will disappear. Okay, there are so many like me. In my class, only 2 people had this problem. So that awareness will remove the taboo. People don't want to show that I have this because it's not written on the face like other diseases. Fair enough, you can hide it. But once you know, you go ahead with the treatment. And now the advances in infertility treatment are to an extent that I would say that we'll hardly see a couple childless if they pursue this treatment. There are all the advances and options available for them. It is for them to pursue that and accept it and have a baby.
But why not to make it as part of their studies? Because while studying also, you have realized at some point in time कि IVF का आपकी medicine, whole medicine में there was only certain paras rather than a whole textbook should be there. So why not to make it as an integral part of their studies?
Yeah,
all
so
the studies, in fact,
right
not
now,
medicine
I
alone.
think even in class 7, there is something about infertility and IVF, science chapter, science book. But the person herself or himself should know what is their fertility potential, at least by the age of 25. Because there are certain diseases when eggs start disappearing at 25 to 26 also. And now we have the option of preserving that fertility. Eggs we remove out, part of the ovary we remove. And then she may not get periods, but at 30 she wants to get married. We can put that ovary back into her. She starts producing eggs and she can conceive. So science had advanced to that level that no female will have to use a donor egg if they know this in advance. For the male also, the sperms are now being produced outside but still not used. But male infertility is also treatable. Nothing is like it's not treatable.
Great. So this information should reach to them.
Yes.
And this can happen, as you were telling, as you were suggesting, the checkup should go on at an appropriate age. Now, I presume our viewers are having enough understanding to understand what exactly IVF cycle is, why it should be done. Now, coming back to that Mahabharata example, which you were highlighting earlier, there is written in Mahabharata that Gandhari,
Yes.
she conceived children and she bore it for almost 2 years. But when she gave birth, it was not children, it was a pound of flesh. Then sage Vyasa, he went on, and what he did, I presume everybody knows the story, but still explaining it in detail. So he cut it into 100 pieces and put it into pots and mixed with some herbs, something, and then how the Kauravas came onto this earth. Now, interesting part is that we have other ancient scriptures too, where medicine has got enough precedent, like Sushruta, Charaka. But from this particular episode, what exactly, or how you can narrate this particular episode in reference with the IVF cycle, that what stage it exactly belongs to?
Actually, this is a part of cloning that they say,
Okay.
surrogacy. Surrogacy as well as cloning, that there were 100 Kauravas there.
But for surrogacy, you ought to have some
Yes, but here
surrogate.
there was not a surrogate mother, but here she was carrying it. So cloning is what they relate to this episode of Mahabharata. That from
Okay.
one piece you get 100 such pieces. Like from one cell if you take, and then electrolysis is done in that cell, and you fertilize an ovum from any female with that cell, a male, you can produce 10 such same males together. So that is related. So in Mahabharata, even the example of Balram
Yes.
was surrogacy.
Yes, it was.
So that was, at that time, the embryo was taken out and put in the
And that story was something like he was already killed and or was about to be
was
killed.
about to be killed. That's why they took it out from there and put it in Rohini's
Another
uterus,
one.
and she delivered. So that is a story of surrogacy, 100%.
So all these scriptures have been written rightly as per you?
I think so, yes, very rightly. Because now we are seeing the modern version of it. Previously, if a king is not having a child, he would be sleeping with somebody and getting a child. So that was, they considered as a traditional surrogacy,
Okay.
just the natural way. But now with IVF, a surrogacy, gestational is possible.
Now we have seen almost all the dimensions which an IVF cycle does consists of. But there is one important dimension which every patient is concerned of, that is economic angle. Now you have seen both the spectrums, both kind of patients into your hospital, that is from privileged class and the lower middle class. And in privileged class, we have seen example. For example, Hollywood में अगर आप देखें, Al Pacino, if you have heard of his name, famous Godfather movie, he was protagonist in that. In 50s, it is very common. In Bollywood also, we have example like Arjun Rampal. So, do they have some sort of better awareness when it comes to fertility, or do they have some better care when it comes to IVF, or is it altogether something else?
Look, for a male, it's not a challenge, the age. Because the male sperms are being produced in the body every 74 to 82 days, even if the male is 50 years, 60 years, 70 years old. Females are born with a certain number of eggs in the ovaries, which start going down in number by the age of 32, 33, and start going abnormal by the age of 36, 37. So by the time she is 40, her eggs are low in number, and then they go abnormal, and by 45, 46, 47, she turns menopausal when there are no eggs. So for a female, the age of the egg is very important. For the male, it is not that important.
Understood. So it is nothing related to economic thing.
No, economic thing, yes. Already when you are well nourished, you are taking proper proteins, proper green leafy vegetables, no carbs, no vices, then your chances of conceiving are very high. A holistic lifestyle. And even if you are economically well off, but you have all these vices and you don't take proper care of your nutrition, the quality of the egg or the sperm definitely goes down.
पर आम बोलचाल वाली भाषा में इसको हमने इकोनॉमिक पर्सपेक्टिव से टैग किया है. रादर इट शुड बी टैग्ड एज better awareness
And better lifestyle.
better
Holistic
lifestyle
approach.
So it's nothing related to economics, it is related to better awareness. Now we have discussed economic angle, we have discussed societal prism. Now there is another aspect of this IVF thing, that is the people who are suffering from the most grievous kind of diseases. मैम आपने ऐसे पेशेंट्स भी ट्रीट किए हैं who are suffering from serious illness like cancer, leukemia and various others. And when they come to you, how much more caution does that adds to their IVF or any kind of assistive reproductive technology method? Or rather, being an IVF technologist, being an IVF specialist, would you recommend them to conceive their children through IVF alone? Or rather, would you suggest them natural conceiving of their children? That
So
selection.
there are so many such diseases like Duchenne muscular dystrophy, spinal muscular atrophy. There are many diseases which a father would not like to pass it on to the baby. Like Duchenne muscular dystrophy, yes, definitely. So number of such diseases, we now do what is called as pre-implantation genetic testing for monogenic disorders, and number of disorders, almost 300 plus, we can do it. So when the blastocyst is created, day 5 embryo, we take a few cells from the outer layer trophectoderm. These are about 15-20 cells. And on those we study that whether this gene which is responsible for the carrier stage of the father or a disease in a brother or sister who is existing is there or not. If that blastocyst is affected with the disease, we don't transfer. But if it is unaffected, normal, then we transfer. So IVF helps so many of such couples where they have such existing disease in the family, or de novo their first child is affected and we want to avoid that in the second child. PGTA is when you see that the embryo is chromosomally normal. So you avoid Down syndrome, etc. in the baby. Then there are patients with cancers or severe autoimmune disease where their fertility, if they are given chemotherapeutic agents, when they are given chemotherapy or radiotherapy, the eggs and the sperms go bad. So before starting the treatment of chemotherapy, we take out the eggs of the female or the ovarian tissue of the female and preserve it. Similarly, for the male, they give 2 or 3 semen samples or 4 vials of semen sample and we preserve it. Once their treatment for chemotherapy, radiotherapy is over and 1 year there is no relapse, they are healthy, they are fine, we start their IVF, and this is only through IVF it can happen, and the couple can conceive with their own egg and sperm, which if they had done the chemotherapy without preserving, the chances are that they would go bad. So even in this terminal patients, there is a possibility of having their own gamete in the future by what we call it as fertility preservation.
So generally nobody should be discouraged. That person who is suffering from any grievous kind of disease,
Yes.
They can have a normal baby.
Yes. And similarly, the girls. Nowadays, we see girls, they don't want to have a child early or they don't find a partner. They want to make their career. So they come and freeze their eggs. At least 15 to 20 we should freeze to have one healthy child. So they undergo the full process of IVF, egg retrieval, and we freeze them. So it's like an insurance. If she gets married at 42, if she's lucky, she conceives. If not, she can use these eggs, which were frozen much younger, and have a healthy baby then. So social egg freezing is now on a rise.
So,
and females should preserve their eggs before they are 34, 35, ideal age.
For this again, awareness has to be of that kind.
Yes. And nowadays, there are corporate companies which also offer this program to their female employees if they have not had a kid and they want to continue the job without having a kid for few years. They offer this to them. And that awareness is very important because, as I said, the men will produce sperms even at 50 and 60. But where will she get her eggs from?
Yes.
This is the insurance, what she freezes over here. And we can freeze it up to 10 years and even more with permission.
Great. And probably as a solution, corporates shall offer to the government that we should have these kind of tie-ups, allow us or rather have some sort of facility in our company so that people can have and get these kind of facilities.
Yes.
Yes.
Because for the female, the career and the reproductive age is the same. So she has to either decide this or that, but not anymore. They can do both simultaneously.
Thanks, ma'am, for informing our viewers about this thing.
Yeah, very important.
Now, coming to the most interesting case which you have dealt with, and that is probably the first case in Asia with which you have dealt, and probably the fifth case in world of a mother being a surrogate for her own daughter. How difficult for you as an enabler where nature got failed to give them a natural birth?
This was a very interesting case and probably, and yes, 100% my first surrogacy case. That girl was born without uterus, married to a very nice gentleman in the UK, arranged marriage, and they knew that she doesn't have a uterus and she'll need surrogate. So they tried in UK, but they could not find one, and also it was very expensive. So they called me and I said, okay, bring your surrogate, I'll do your surrogacy. For 3 months, they searched in India for a surrogate. This was in 2002, 2003. They could not find one.
And probably this facility was being provided by you.
No, that time I never did surrogacy because in India, surrogacy became legal in 2002.
Okay.
April. The first law came that surrogacy is now legal in India.
Okay.
So then I tried to convince the mother. First of all, the mother-in-law was ready, but she was diabetic, she was hypertensive, and I said, no, you are a very high risk. But she said the mother of the girl is not ready because she thinks this is very unnatural. How can I carry my son-in-law's embryo? All those thoughts, because they were very conservative. And I said, this is your daughter and your son-in-law's baby that you are carrying. You are helping your daughter by giving this beautiful gift because she doesn't have a uterus, a very pretty female. So she agreed. But she was more worried about the society, that what will they feel when they see me at 46 pregnant like this. So she went into a hiding for last 4 months, telling everyone that I'm going on a pilgrimage. And she stayed in a remote area and then came for delivery. And then they came out in open that, okay, I'm delivered. So this was a very touching, very interesting case. And I asked myself first before telling her that if such a thing would happen to my daughter, would I do it? I said, of course, any mother would do anything for the child.
Yes, this has provided strength for the further generation. This
yes,
has already happened.
Yes. So then I thought there's nothing ethically wrong about it. We should go ahead and do it. And I did it. Never realizing that only 4 such cases had happened in the world before.
Yeah, this is great story, ma'am. Ma'am, you are now exploring stem cell therapy for the infertile patients who have exhausted all their options through various other assistive reproductive technology. At what point would you call it a breakthrough to announce it publicly as one of your way to treat infertile patients rather than letting it be just an experiment?
So it was almost in 2014 when I realized that we cannot do anything about low quality eggs, low quality sperms. What should we do? And then I started reading on this and attending conferences on stem cells. And I found that it has, because there are very minute eggs and sperms which are still present in a female who is already menopausal, the eggs. And the sperms also, if they are poor quality, they can be rejuvenated. So how do we rejuvenate the ovary or the testes? And for ovary, I started thinking of stem cells. Again, a controversy. But for me, since 2014, I have helped so many couples. And I think that stem cell, it has already been approved for a number of diseases in India and in foreign countries. will be the promising future for infertile patients, especially when it comes to low quality eggs, a very thin damaged endometrium when they say surrogacy is an answer, or very poor quality sperms. So I'm a staunch believer in it, and I see a bright future for this.
For our audience, I would like to correct one word which you use here, controversial. Rather, I would say Dr. Nayana Patel has a trait that she picks up the technology at a very nascent stage and she make that realize. And that is what the bridging trait of Dr. Nayana Patel people should admire and take it as a blessing that their future generations are all dependent onto this with the present kind of fertility rate, which even WHO have also acknowledged that almost 1 in 6 six
Couples
people
suffer
of
infertility.
reproductive age.
And it's on a rise. In India itself, in Gujarat, we are seeing declining fertility.
Yes.
Less than 2% is bad. So it
is.
has to be improved, and we have to do everything best possible ethically for the patients. And for me, anything new that comes up is a challenge, but I am the type who will adapt it very easily. If I am not happy with my first 30 patients, yes. But if I am happy, I will go after it and do it. There is nothing like which is impossible, provided you deep dive into it and understand everything and go ahead with it. There is nothing like it cannot be done in a small town and can be done in a big city only.
Yes.
You can create that atmosphere, that environment in your small town itself. Only thing, you need to work hard. No substitute to hard work.
And probably because of this spirit, you have been invited on the top shows of the world. Oprah Winfrey have aired you, BBC's Hard Talk, against which many people have suggested you don't go there.
Yes.
But you gave taste of their own medicine to them.
Yes.
You have also been aired on, you have also been awarded by Gujarat Chamber of Commerce and many such awards. But which specific show or which specific award has taught you much more than your whole life's experience?
I mean, look, awards everybody would like and enjoy and relish.
Yes.
But to me, the tagline that Oprah Winfrey gave to surrogacy was like unimaginable. She said, "One woman helping another woman, I love it." Because a man cannot be a surrogate. Even if the husband wants to carry, he cannot. A brother wants to carry, he cannot. It's only a female who can come and help this helpless woman. So she tagged the show as "One woman helping another woman, I love it." And I am for that only. That all the women on this earth should get the best and get the best life. And I love that.
Thank you, ma'am. Thank you very much for being this blessing to our Mother Earth and to all other mothers who are thinking of having their babies. And probably you are the one solution for all of them. And would like to end this show for our audience where they can see the feeling of the people which you helped. So would like to read out few quotes or few comments from Instagram for those who have posted stories on your page. So for our audience, I am reading out comments after seeing a reel which you have posted on Akanksha Anand Hospital. There, one doctor is carrying baby in her laps and she's taking the baby at the doorsteps of God. So the first comment reads out like, "सर की आवाज ही आधे दुखों का इलाज कर देती है. God bless doctor." Another comment from another person, "This is my boss. This is my boy. Thanks doctor and thanks Dr. Molina. आप लोग कितने परिवार को खुशियां दी हैं. अल्लाह आपको हर खुशी दे. Amin." Now this is what may be the driving force for you.
Yes, this is the driving force. Whenever a couple is getting this child and they come to us again from so far away, they come from Himachal, they may come from Hyderabad. In the inauguration of this hospital, a couple with their triplets arrived. We read it that this hospital is getting inaugurated. I wanted my 3 kids to be here with you. So how much they feel there every day, you are in my prayers. Because of you, I'm enjoying this life. Otherwise, I would have died long time ago. I did not want to live. Such messages when you get, you feel that, okay, whatever we are doing, maybe we are not successful in all the cases, but wherever we have been successful and wherever we have been able to give this happiness and see these beautiful children grow, I mean, it's unbelievable. My children who have grown up become engineers, doctors, and even got married with IVF. I feel so much for that because the parents, they come to us with the invitation of the wedding card also, that your IVF baby is getting married, you come for that. So any such thing, and especially it's not only the couple, it's the whole family. I've seen that they all enjoy this baby so much that the grandparents I've seen touching my feet, that because of you, my son has a child now. So these all are, I tell you, God gifted moments which only lucky ones can get to see in life. Really. I tell you that you may be the biggest businessman with the loads and loads of money, but the happiness that we get when we treat this patient is nothing compared to that. I'm telling you. It's
And
unimaginable.
this is what actually the mantra of your
Yeah.
success, of your happiness, everything. Because nowadays everybody is vouching for success. Anyhow, they are keen to find a therapy that how they can be successful. Because many people are asking successful people like you, the doctor, what you are doing daily differently, which we should do to become successful. And I would rather tell it to them that it is not about their daily routine. It is about the daily happiness, the daily blessings, which they are keep on aggregating
Yes.
and becoming successful.
Passion, compassion put together with hard work.
In fact, in one of our episodes, we did earlier with one of the renowned dancer from Baroda, Dr. Parul Shah. She told that your devotion comes from your nature and nurture. And this is what I'm seeing here. Your devotion towards your patients, towards your kids. This is what your nature is, and this is how you have been nurtured.
Exactly. Be very compassionate. But in our business, it's only compassion and passion and
Thank you,
everything
ma'am.
else is secondary.
Thank you, ma'am. Thank you very much for being on our show. And any message for our audience if you would like to give through our platform?
Look, I would say that Anand I consider as a suburb of Baroda. So we are one only. Always I say that.
Yes.
Baroda and Anand are like one. And I would say that anybody who is listening to this, that whatever problems, including fertility or infertility in your life, accept it at the early stage, start working on it, and you will be surprised that nobody will remain infertile. So don't give up. Follow this dictum that if you pursue, nothing is impossible, everything is possible. And when there are challenges in life, consider them as your opportunities, because you don't know when a challenge could become an opportunity and give you that dream fulfilled what you wanted.
Thank you, ma'am. Thank you much for your blessings.